Hi, Dr. Sadeghi. Thank you so much for joining us today.
Thank you. Thank you for having me.
So, Dr. Sadeghi holds the position of chair in the Department of Otolaryngology, head and neck surgery at McGill University. He also serves as Chief of Otolaryngology, head and neck surgery at the MUHC and is the director of the McGill Head and Neck Cancer Program. Dr. Sadeghi has delivered lectures internationally on head and neck surgery and minimally invasive surgical techniques. His research primarily focuses on head and neck cancers, and he has pioneered innovative therapeutic, adaptive, and personalized approaches to oropharyngeal cancer, including transoral robotic surgery and transoral laser microsurgery. So thank you again, Dr. Sadeghi. And, as an expert in oropharyngeal cancer, I'm wondering what you see as the role of head and neck surgeons in the prevention and management of HPV-related diseases.
Yeah. Thank you. So, as you know, we do see, HP-related, disease in our specialty, in particular, oropharyngeal cancer. So it has become part of, sort of, the our specialty to encounter, the HP-related disease. And I think, we need to be advocate, for vaccination. I think that would be the primary goal. I would say that in terms of the vaccination, when you see patients and families, especially those who've had oropharyngeal cancer, that's a very good point to bring up the vaccination. A lot of adults that actually, should be vaccinated are not vaccinated. And when, a patient is talked about vaccination, accept vaccination, they become actually themselves ambassadors, to their families, friends, children, to get vaccinated if they have not. So I think the topic of vaccination is important to bring up with our patients, when we see them. And I think that's how we can, we can help, in prevention. Of course, therapeutically, we're involved with oropharyngeal cancer. That's one of the, cancers that, we treat. And that becomes often, the reason to bring up the topic of vaccination and HPV infection in general.
Definitely. And, recently we've been seeing that the rate of oropharyngeal cancer is continuing to increase, especially in males. So I'm wondering what you see as some of the main reasons behind this. And we've already talked a bit about, patient education and patients also advocating for their care. But what can we do as in the medical community to address this problem?
Yes, yeah. The oropharyngeal cancer has been in the rise, among cancers, and head and neck cancer in particular. While other subsites has somewhat decreased, especially in the industrialized world. We see a reduction, for example, in the laryngeal cancer rate, thanks to the decreased rate of smoking, obviously, tobacco exposure. But the incidence of oropharyngeal cancer is actually increasing, across the industrialized world and other parts of the world as well, and that's a huge problem. So right now, depending on the location, on the planet, it varies the rates. But I can tell, for example, in Quebec, in Montreal, for example, over 90% of the oropharyngeal cancers that we see are HPV related. Maybe only 10% would be tobacco related. Whereas, vast majority of oral cancers are tobacco related or laryngeal cancers are tobacco related. So HPV, obviously is important cause the factor of oropharyngeal cancer. And again, this is a new disease, obviously, and all the therapeutic strategies that we have developed for head and neck cancer has been actually based on tobacco-related squamous cell carcinoma, which carries a different biology, pathophysiology, and the mutational, landscape is very different than HPV-related squamous cell carcinoma. Hence, this is a new disease in a way, even though it's squamous cell carcinoma, but it's not the same biology as tobacco-related squamous cell carcinoma. Hence, part of our sort of, I guess, responsibilities would be to really understand the disease better and design treatments that is really specifically suited for this disease versus tobacco related. Of course, our treatments that we have developed for that, be it radiation therapy with or without chemotherapy or surgery with risk-adjusted adjuvant radiation, is very effective for head and neck cancer in general and oropharyngeal cancer. But again, is this, the way that we should treat a disease when these strategies together, combination of strategies have been developed for non-HPV oropharyngeal cancer. So I think that's part of our sort of, what we can do to think basically, how we can, while improving the outcomes, obviously, in terms of the oncological outcomes, how we can design treatments that perhaps can be less toxic, especially when it comes to the late and long-term effects of treatment effects. That's part of what we have to be mindful about, and also we have to think about developing new methods of effective screening for these types of cancers, especially effective surveillance. These patients, when they are treated for oropharyngeal cancer, the surveillance, obviously, the current surveillance we have is quite good, but quite intensive, requires a lot of time and financial burden on the healthcare system, as well as on the patients and their families. So a better surveillance methods for these types of cancers can be developed, that I think also coming. Actually, these things are happening as we talk.
Definitely.
So our response is really on the part of treating the patients, obviously getting a better oncologic outcome, improving the quality of life and the patient-reported outcomes with the treatment of this disease.
Definitely. And I'm curious, with surveillance, do you take patient demographics into account? Because as I understand, HPV associated oropharyngeal cancers, the rates are increasing in both men and women, but the incidence rate is much higher in males compared to females. And that rate is also increasing at a much faster rate for males compared to females. So is that something you take into consideration?
Yeah, this is a very important question, and it is for sure at the moment the preponderance of oropharyngeal cancer that's HPV related is among men, and there's a good reason for that, right? And I'm just going to share some slides, kind of drive that point home. First of all, just this one here, this is sort of shows the distribution of the oncogenic HPV infections in males. This is among males, and as you can see, infection can happen at any age, as young as 18 or 19, and it can go all the way to age 70. You can catch oncogenic HPV infections. It peaks, at around 30, 34, but it doesn't diminish after that. Same thing with non-oncogenic variants of HPV infection. As you can see, it actually keeps increasing with the age. In the older ages, there's even more chance of getting infected, and this is for men. So there's one problem, that in fact, the infection is a problem throughout the life. The other thing that's important in terms of the rate, why is it so different? I think this graph can sort of pretty much kind of say why. Part of it is that vaccination started much before on females, and only later on male vaccination in the schools included, right? So as you can see, from, let's say, 2006, before that there was no vaccination, and then 2019, you can see that the rate of vaccination in women is much higher, right? This is cumulative vaccination in the countries that have vaccination introduced and do that. But in men is low still. Even 2019, you're talking about 88% of the females, getting vaccinated in early age, in the program, but only 44%, right? So there's a low rate of vaccination for men to start with. Second of all, part of it also goes into this is a sexually transmitted disease in a way. It is very well known that the number of sexual partners, and especially oral sexual partners, is directly associated with the increased rate of infection, as well as oropharyngeal cancer development. And some of those may have also influence on why there's more happening in men. Look at the lower income countries, and that was a higher income country that I shared with you, that its vaccination rate is not too bad. If you look at lower income countries, the picture is even worse. You can see that only 40% of the females in 2019 get vaccinated, and only 5% of the males. So it's a problem of vaccination. I think the discrepancy that exists, and hopefully that will be addressed with time. And that is the part of the problem. And the other issues that is important to think is that vaccination rate throughout the world, look at this thing, is not uniform. You can see that in green are the areas of the world where actually there is a vaccination program. all the areas that are not green, there is no vaccination program. Few places there's no information, but there's just no vaccination program. You can see that America is not bad, it's pretty good. The Western Europe is quite good. Some of the African countries are good, but a lot of, a large swath of population internationally, are not covered by vaccination. And if you look into Europe, I mean, there's a discrepancy between the Western Europe and Eastern Europe in terms of the vaccination program. A lot of countries in Eastern Europe do not have national vaccination programs. So I think all of this, leads to obviously, the disease that's associated with HPV. And for men, it's affecting, for oropharyngeal cancer. But again, talking about the, problem of cancer, it also is geographically varies. I'm going to share with you here sort of the internationally, globally, the burden of HPV related of cancer, basically. As you can see on the larger pyramid is the less developed regions of the world. Still, cervical cancer is the predominant, cancer caused by HPV, almost 93%, and oropharynx is very small. As you move to the more developed countries, you can see that the rate of oropharyngeal cancer is increasing. Up to 13% of the cancers, is that, but it's still 65% is cervical cancer. When you look to more developed countries, and this is Canada, US, Western Europe, etc., then all of a sudden actually changes. You have oropharyngeal cancer actually is the largest portion of the HPV-related cancer. Then comes cervical cancer, of course, other anogenital cancer that also occurs. And the other thing that I want to draw attention to is that, the burden of HPV disease is really, is gender and sex agnostic, right? So we can see that, it involves, both male and female cancers. And even look at, the sort of, more industrialized countries, US and Canada has similar picture, is that, yes, there's a lot of oropharyngeal cancers male and less so in females, about 7%, but then there's cervical cancer in females. So look at the cumulative, you can see that in fact, that other, genital cancers, again, affects both males and females. So this, virus is really, is a sex agnostic and gender agnostic and causes cancer in both, both populations. But oropharyngeal cancer certainly is higher, among men than women. This may have to do with the sexual practices.
Oh, I see. And
And
I
the other
think
thing that we don't know what they may have to do with is that, there's a lot not known in terms of the immune interaction between the HPV infection and eventual, basically incorporation of the I guess virus genomes into the host genome and eventually causing mutations and cancer. And oropharyngeal cancer occurs, obviously it's in the Waldeyr's ring, area of the tonsil and the lingual tonsil. We have a lot of lymphoid tissue there. We don't really know how the interaction happens, but it is really involving the area of the pharynx that's actually very, heavy with the lymphoid tissue.
this is all so fascinating. And I think it's such an important message to drive across as well that, like you said, HPV related diseases, it can be it's sex and gender agnostic. It's not an issue for just one specific population. So how do you see we can address the ongoing misconception that, for instance, HPV is exclusively a medical concern for younger women? Because I think for a lot of people, when they think of HPV, they think of cervical cancer rather than other cancers like oropharyngeal. So what are some opportunities we can take for patient education?
Yeah, absolutely. It's very important to know that, HPV infection, as far as the cancer, as these, really these statistics clearly show is a sex and gender agnostic, of course, both. And, and the importance is that there's actually more than, obviously, just cancer. It looks like, for example, this is, I want to share with this, this is the European data on HPV related disease, right? Not just, cancer. We can see that really at the bottom of the pyramid, the huge number of patients have genital warts, right? And this also happens, as you can see, both males and females. This is gender agnostic. And they've got a cervical cancer, and after that, they've got the head and neck cancer, obviously, vast majority of oropharyngeal cancer. Then you've got, in both sexes, and you have, anal cancer, vulvar vaginal cancer, and penile cancer. So you can see that all kinds of cancer happening, but also all kinds of non, cancer-related disease comes from HPV. So, and this affects both genders. As you can see, in the genital warts, there, again, you can see affects a lot of male too. In fact, affects more males, slightly more males than females. So it is really a disease of, both genders, the HPV related disease. So I think the message, I think that, we have to pass to the young people as well as the old is that, it is not just for prevention of cancer. HPV, control is really prevention of the all kinds of diseases that's caused by HPV. In fact, a lot of young as well as older individuals may be much more affected by the concept that it can cause genital warts. It has kind of such a kind of connotation that I don't think anybody wants to have that. So I think talking about the non-cancer kind of disease that's caused by HPV is also important to drive the message home, in terms of prevention as well as vaccination.
Definitely. And if there's one thing that you could share with listeners, one clinical pearl that you would like listeners to take home with them from our discussion today, what might that message be?
I think the message, is that I think we have to talk about this disease and we have to talk about our patients and educate our patients, because every patient that you educate, that patient themselves become educated for their friends and families. So I think that's how, the word spreads. So I think we have to be advocate, for our patients and an advocate for vaccination. The other thing that I didn't talk about it, that of course, the earlier the vaccination is introduced, the better it is. And that's why, most countries who have vaccination programs introduce vaccination, early on, right? And the data has shown that. It's just, this is like unequivocally, the earlier the vaccination, the better it is. For example, this is the, this invasive cervical cancer incidence according to the vaccination status. If someone is unvaccinated, as you can see, this starts having a rate of cervical cancer as early as early 20s and can go high up. No, these are young people getting cervical cancer. If they are vaccinated between ages of 17 and 30, right, the rate decreases in blue, right? But still, you can see that there's a large number. But as soon as those who are vaccinated before the age of 17 in green, then you can see that the rate is much, much lower. So it shows that early vaccination is really the solution to prevent a lot of HPV related disease. And the other thing that's important is that, of course, we have good data on cervical cancer, and that's partly why cervical cancer is decreasing, in industrialized countries. Number one, there's a better vaccination, right? And a lot of females who do get, cervical cancer, that can be at a very young age. You're talking about, it starts at the age in 20s, up to 40s, right? That's young. And a lot of patients that are in that age group are already vaccinated, actually. So vaccination has been part of the prevention. So we can look at the cervical cancer, in cervical infections in females, right? From 2003 onwards, let's say this goes up to 2014, you can see that there's been 71% decrease in the rate of infections among, cervical, HPV-related infections, right? And cervical precancerous lesions, right, has also diminished, right? Because of that, obviously, because of vaccination. And in the cervical cancer, we have a method of identifying precancerous lesion through colposcopy and looking for neoplasia, intraepithelial neoplasia in females, and therefore prevent them from evolving into invasive cancer. But for males and oropharyngeal cancer, we don't have that. We don't have equivalent of doing cervical biopsies and colposcopy and looking at at the precancerous lesion of the oropharynx. So hence we discover them only when they have developed invasive cancer. That's another problem of oropharyngeal cancer. For oropharyngeal cancer, we don't have the rate of cancer for not just increasing. There's no decrease yet, but you can see that oral HPV infections is actually, when they're vaccinated, goes down tremendously by 88%. So we know that the vaccine prevents oropharyngeal HPV-related infections, and if you prevent that, you're going to prevent HPV-related oropharyngeal cancer. And again, the other thing that I want to share with you is that if you look at this data, for example, this is from the US. It shows that what is the basically number of individuals that are infected. Just in the US, you have close to 1 million people that get infected, by HPV disease, right? And with the current rate of vaccination in the US, which is low, especially for men, you only are preventing 17% of the infections. But if everybody, there was 100% vaccination, you would prevent, basically a vast majority of them, close to over 90%, in yellow, or right? And same for women. Right now, with the current rate of vaccination in the US, out of 306,000 infections, we're preventing 25% of them. But if everybody was vaccinated, then you would prevent, vast majority of them, over 88%. And for men, same thing. A very small percentage of, infections for men are even only 7% are prevented now because the vaccination rate is much slower. But if we're all men or boys were basically vaccinated in the school, you could prevent, pretty much, all vast majority of the HPV infections. So again, the message drive home is really solution is really education and vaccination, so we can increase the uptake of vaccination, in the society.
Definitely. And vaccination is so important. We talk about it all the time, but I think when you see data like this presented so visually, the contrast really is quite glaring. I wasn't expecting that. I wasn't
Yeah.
expecting something that drastic.
Yeah. The other thing that I think is less well known, because this is relatively new, is that, for example, in Canada, about, I guess, 2 years ago or so, the guidelines changed in the country that, in fact, adults should also get vaccinated. And they set the age of 45 that, actually recommended, vaccination, even those up to now was up to age 26, and then they expanded from 26 up to 45. And again, 45 is not a magic number. Why 45? Because they studied up to 45, right? You kind of, study population. Therefore, you're going to make a recommendation for the population that were in this study. But in fact, it doesn't mean that over 45, there's no benefit from vaccination. Why? Because, like you showed the data before, people get infected at any age, including in much older age of 60, 70, etc. And hence, if you get vaccinated, which includes not only the oncogenic variants, all the types of oncogenic variants, but also HPV 6 and 11, which are non-oncogenic, you're going to prevent these, basically, new onset, HPV infections. So because of that, vaccination for adults are important. Again, at least we should be aware that up to 45 is actually recommended, and this is adopted by, Canadian Otolaryngology and Neck Surgery Society, by Canadian Society of Gynecology, and other medical societies in Canada. So it's important to pass that message and also talk to adults about vaccination, not just their children, but themselves as well.
Definitely. And thank you so much for sharing this message with us today. I think especially with HPV week, teaching and educating our patients, helping our patients realize what they can do to take control of their health. I think that's so powerful. So thank you so much for sharing your expertise with us today.
Thank you. Thank you for having me.